Hi everybody, welcome to Beauty Buzz with Lori. So I have just performed dermaplaning on this patient, and now we're going to move into a Signature HydraFacial. So Signature HydraFacial is the basic HydraFacial. Basically what we're going to do is we're going to cleanse the skin again with the machine. We're going to do some more exfoliation. This patient does use retinol, and she was having some exfoliation which caused these little breakouts here. I'm just going to use the 7.5% glycol. So that is 7.5% glycolic with 2% salicylic mixed in. The salicylic is nice because it actually gets down into the pores. It's oil soluble, so it helps to loosen the sebum up off the follicle wall so that when we do the suction for the extractions, that just slides right out, and then we'll get to see all of that fun stuff whenever we clean the container out. All right, here we go. So we're gonna get our first serum going. As you can see, she's a little pink. That's not uncommon. By the end of the facial, she might be slightly pink, but that disappears within an hour or so. Now, just to be clear, the HydraFacials, none of them include the neck. My personal preference whenever I'm treating is I like to treat the neck. If the patient wants to do the peel on the neck too, then I do upcharge for that to cover the cost of the peel. But I do the first and the second solution in the machine on this as well. I don't spend a lot of time on it. I just like for it to feel like a nice complete treatment. Alright, so that's the first serum. Now we're going to do the glycol treatment again. I'm just going to do the 7.5% glycol. Pop that in there, adjust my flow. Alright, just let me know if you need the fan, okay? Okay. I always like for my patients to keep their eyes closed during this process because sometimes it can splatter when it's being applied. So this is going to help these. I'm going to make sure and get these really good so they'll heal up nicely for her. Make sure I get the nose really good because that's where most of the blackheads hang out. You doing okay? Good. Alright, on a scale of 1 to 10, 1 being you don't feel anything at all, 10 it feels like your face is on fire, what are you feeling?
Like a 3.
Okay. You want the fan or are you okay?
I'm good.
Alright, so now I'm going to change out my tip for the extraction tip. We've let that sit on there for a minute or so, and now I'm just going to start going over the T-zone area. So for a patient who maybe has large pores all over the face, I will veer from the middle of the face and address those pores as well. But for this patient, she doesn't have that problem, so we're just going to stick to the T-zone area. So with this, they're going to feel a higher intensity on the suction, and we're going to do slower strokes. So we're giving time for that suction and the solution to pull everything out of those pores. So if a patient needs more extractions and all they have booked is a Signature HydraFacial, let's say it's their first time with you as a patient, they're going to need to come back for a clarifying HydraFacial unless you have time to upgrade their facial experience with you, because the clarifying HydraFacial is going to, that's the whole intent for that, is to make sure that you're not only getting the suction extractions, but there's time to also do manual extractions if needed. I like to leave the nose for last, so I'm just going to come. She's got a few little pores right off to the side. You want to be careful about going over cheeks that already have broken capillaries. You can just lower your suction level to help with that because you don't want to cause more broken capillaries. Also, if you have someone with really thin skin, you want to lower that suction too, because it can draw the blood up to the surface. And we don't want to leave streaks on the face. If you see that start to happen, immediately pull away and just adjust your suction. I like to go over that lip line because sometimes we get little blackheads in there. I don't see any on her, but still. Okay, now I'm going to come back up to the nose. So don't be afraid to flatten that nose out so you can really get in there with the smaller tip. That's the whole point for the smaller tip. Get in that creased area where a lot of those blackheads congregate. You can squeeze the nose up a little bit. All you're doing, you're not actually squeezing the nose, you're just pulling the skin up so it creates a nice bridge, and you can get the bridge up the nose. And I like to go this direction as well. Clean. You can see she's already got a nice sheen to the skin. So she's going to have a pretty glow whenever we're done. We are going to use just a little bit of water in order to neutralize the peel for her, and then we'll move on with the next solution where we're going to Hydrate Nourish. The skin already looks so good. So you can just use 4x4s, and this is actually good because then you can see anything that might be left on the white cloth. Always make sure you get in those creases because the little bit of peel left in there can actually leave them red and cause them to scab and flake a little later on. Remember, we only put the peel on the face, but you want to come all the way back into the hairline. Make sure that you've got it all off. Okay, do you have any sensation left over from the peel? Nope. Sometimes when I ask that question, patients will say either around the nose or the upper lip area, that perioral area sometimes, and so you just get clean wipes and go right back over that area. All right, now we're going to Hydrate and Nourish. You want to keep it tight so that you're hydrating the whole area, and then just make sure that you're following up with your fingers so that the fluid is not running into their ears. And this is where I go over the neck too, just a few little dabs, and then you can kind of spread it on. You don't have to use a whole ton of fluid. I'm really going to hydrate this chin area here because she was having some excess peeling from the retinol. And it'll help with that healing too for those little areas. So that actually completes the HydraFacial. I like to go ahead and kind of just do a little bit of massage, make sure that all of that solution gets into the skin so she gets the maximum benefit from her treatment. Plus, if you apply a hydrator over top of this, it's going to take you forever to rub it in. So once I'm done getting this to completely soak into the skin, you'll still actually see it might look like it's still a little wet, but it's actually going to be dry, and that's the glow that the HydraFacial gives to you. And then the dermaplaning treatment just enhances that even more. They pair really nicely together, those two treatments. So her skin is dry right now. There's no more liquid on her skin, and you can see how beautiful that is. So I'm just going to finish her up with a hydrator, a little bit of eye cream, and a sunblock, and then she's good to go for the rest of the day. Thanks for watching, you guys.